Okay, so what we're going to go over now is leaky gut, inflammation, and autoimmunity. So when I talk about leaky gut, we're actually referring to your small intestine. So you can see right here, we're referring to the small intestine. So that's basically this area right in here. So your small intestine is roughly 25 feet long. So when I talk about the small intestine, or when I talk about your gut, okay, when I talk about your gut, I'm really referring to your small intestine, which is roughly 25 feet long. So what the research shows is that 80%, this is a pretty drastic number, 80% of your immune system is located in your gut. Now 80%. So you can go and Google this. So if you have an autoimmune condition, I mean, an autoimmune condition is when your body's actually recognizing your own tissues as foreign and starts to attack that. And 80% of your immune system is located in the gut. So when we talk about functional medicine, getting to the cause, the root cause of the problem, you have to fix, you have to heal and seal your gut, your small intestine, which is 25 feet long. And there's no drugs, there's no prednisone, there's no methotrexate, there's no Humira that are going to actually heal and seal your gut or your small intestine. So let's just kind of go over your small intestine here. So I have two pictures. This picture right up here, this is of your skin. So this would be a picture, this would be, skin on your thumb or something like that. And then this right here, this is your gut or your small intestine. So one of the things that happens is when it comes to your skin on your finger, you can see down here, that is the bloodstream, or down here, that's the bloodstream. So if you look at this, in order for you to get a cut and you actually to see blood, you have to go through like 10,000 skin cells, right? So this is really, really thick before you get down here into the blood. So 10,000 skin cells you have to go through before you actually pierce blood. Now let's contrast this to the picture over here to your right, and this is the small intestine right here. Now what I want you to bring your attention to is you can see this, that's your bloodstream, okay, versus down here, there's your bloodstream. So when it comes to your small intestine is only one cell thick. So I want to repeat that. It's one cell thick. Look at this. It's one cell thick versus here, your skin cells are roughly 10,000 cells thick. So my point being here is your gut, your small intestine, 25 feet is only one cell thick. So it's a very, very, very poor barrier. And when you have a poor barrier right here, your gut can become what we call leaky gut. So one of the things is when we talk about functional medicine is we really need to try and handle and heal and seal your gut. So I'm going to go into the next slide here. So this is just blown up, right? So again, we have this. Which is your bloodstream, right? And then we have this, which is one cell thick. Now, what happens is when you have inflammation and your gut's leaking, you can see in here, I've circled basically two cells, and then right in here is what we call a tight junction. So, if you can see initially here, the tight junction, these cells are basically meshing together here. You can see that. Now what happens is when you have inflammation, you have leaky gut, this shows the disease in progress is your gut starts to become leaky. And you can see right there it's starting to deteriorate. And as time goes on, your gut becomes more leaking. All right. Or another analogy I would say, this would be like, if you have a house, a foundation, and there's bricks there, right? When they made foundations out of bricks versus pouring cement, you'd have a brick, and then between each brick, you would actually have the cement that holds the brick together. So I consider this right here, the gap right here, this would be like the cement that holds the cells together. Now why this is so dangerous is up in here we have your food, right? So this would be your small intestine right up in here. So that's your food. So let's say you just ate some gluten. Now gluten comes from wheat. So this is a protein, but this is an example of any food that you eat. Now here, if your tight junctions are intact, you can see here how these food particles would not be able to cross this barrier. Now what happens in leaky gut, as you can see right here, the barrier starts to break down, and the food particles can get into your immune system, or actually not into your blood. Now this is very dangerous. Now what happens is when this little piece right here of gluten gets into your immune system, or gets into your blood, your immune system recognizes that. So your immune system can see that gluten, and this is a really large particle. It shouldn't be there. And any time that this happens in your body, when you have leaky gut and you have these large particles, your immune system starts to attack it. And when your immune system starts to attack it, then what happens down here, you start to get food intolerance, you get systemic inflammation. Systemic just means all over your entire body. So of course this is in your blood, right? The gluten's in your blood, and then when this is inflammation here, that inflammation will start to travel throughout your whole bloodstream, and this is why they say that it's systemic inflammation, because it goes everywhere. So you can have pain in your arm, you can have pain in your leg, you can have fibromyalgia, you can have brain fog, and then down here at the bottom, you can see all these things here can happen if you have this leaky gut. Poor absorption, because your gut's inflamed. Autoimmunity, which is big. Now also what happens, if you look up on top, this right here is what we would call is a bacteria. So you have good guys, you have bad guys, but when you have this leaky gut, right there, these bacteria again can get in your bloodstream and cause inflammation, right? And then this goes your whole entire body, and it starts to attack. It starts to attack things. This is the most dangerous part about leaky gut is when you have this inflammation in your bloodstream here. That inflammation will go and start to attack other tissues. Now, what happens is your immune system here, let's just go back to gluten here, which is a protein in wheat. Your immune system, once this gluten molecules in your bloodstream, your immune system recognizes gluten. Like these little particles have a certain appearance, just like just like people's faces. You recognize people by their different faces. So your immune system always is going to recognize gluten as foreign. Now the dangerous part about this is when you have this increased immune system, the gluten molecule that you just ate looks exactly like your tissues. So in other words, your body cannot differentiate between what gluten is and what your thyroid is, or what gluten is and what your skin tissue is, which would be like lupus, what gluten is and your joints, which is rheumatoid arthritis. Your body can't tell the difference between gluten and your digestive system, so you can have irritable bowel or Crohn's disease. So this is why it is paramount that we handle your gut, your digestive system, to decrease. We want to decrease your inflammation in your body. That's the whole goal in this. So at the end of the day, we want to reverse this and bring you back this way to healthy junctions. And then when you do that, you decrease your autoimmune response and your inflammation, and 80% of your immune system is in your gut. Now, one of the things too, if you look at this cell here where it says leaky and inflamed, when your cell becomes this way, I phrase it as in your cells have become crusty. So just imagine these cells, these healthy cells, as a jelly donut, right? There's nice, a fresh jelly donut, it's really pliable. Then if you leave a jelly donut out for a few weeks, so let's say you leave it out for a few weeks or days, it's going to become crusty. And just imagine all your cells being crusty, and this is what causes an additional inflammation in your body. So again, you're only as healthy as your individual cells. You're 100 trillion cells. So just imagine this here. Just imagine the outside of your cell here, right, is become crusty. And when the outside becomes crusty, that increases inflammation. Okay? So the goal of getting to the cause, or functional medicine, is you got to rehab, you got to fix your cell membranes and decrease inflammation. You're only as healthy as your individual cells. This next slide here, that's a movie that I'm going to go over, but it's actually, it's going to take you right into, it's going to show you up close and personal this view of your small intestine, the one cells, and then your bloodstream right here. So it's a really good video, and I'm going to narrate this as we go along.
T-Rex then migrate to the lab.
So one of the things is that what you want to be looking at here right here. So this is your small intestine. Okay, so you can see these little lines right here. Okay, these are what we call, they're just like little, like shade carpeting. Shade carpeting is a good analogy. They stick out right here. All right, and then you can see in here that these red little lines right here. Okay, that's the blood flow. And then we also have blood flow down in here. So the next video, or as we go on here, what we're going to do is we're going to blow up that little tip right there. So there's a whole bunch of shade carpeting, and then on top of the shade there's even more shade carpeting. Okay, so you can see how we're blowing up that little. So you can see here how we're blowing up that little tip there. So what you want to pay attention to here is, okay, this is your individual cells, and this is your blood. All right. Now, you can see up in this area in here. Okay. Now this is really, really critical. This area right in there, because this is on your small intestine, you have like saliva. So just imagine saliva in your mouth. Like if you don't have saliva in your mouth, or if you have dry eyes, your cells don't function right. Your mouth doesn't feel good. Your eyes don't feel good. So having a good digestive system here, you have a nice layer of saliva, okay? And that's in your digestive system. So as you see this video go, you're going to see what happens to your saliva layer up in here. It actually starts to degenerate and decay. So you can see down here that this right here is your immune system starting to act. Okay, your immune system is starting to get fired up a little bit here. So now as this inflammation starts to take place, you can see how this saliva layer right here, the saliva layer is starting to disappear. This is what we call the beginning stage of a leaky gut or inflammation. And what this is right here, how your immune system works, is it actually goes up and pulls food particles and brings them down to sample them to see if you have any bad guys there or if we need to increase your immune response. So you can see how it's progressively getting worse. It's getting worse. Now look at this down here, your immune system. Your immune system down here is really starting to fire up. It's producing a lot of inflammatory processes, causing more gut problems, more irritation, and more leaky gut. And you can see it's just continuing to get worse and worse. And then you look at the below. Look at this down here and pay attention to your immune system down here. Pay attention to that. That's your immune system starting to get fired up. Now if you pay attention, if you pay attention to this up in here, okay, pay attention to that. These are all the bugs, bacteria, and food. And you're going to see how they get right into your bloodstream here, causing more inflammation. It's getting worse, more damage. The cells are becoming what I would call crusty. You see that cell right there? How it's becoming very crusty. You can see the tight junctions are becoming loose. More food is getting in there. The immune system is getting worse. Okay. So one of the things is what we do when we talk about functional medicine. We actually can check to see. We can actually check to see if you have what we call like leaky gut. So this is one of the tests that we do. And sometimes there's some confusion. So the test that we do is an IgG, and then there's an IgE. So I just want to clarify these two things. So this right here, people say, well, yeah, I've had something like that. I think I went to the doctor and they put a bunch of things on my back, and they told me I was allergic to pollen and trees and dust and cat dander. So that's an IgE. This is an immediate reaction, right? You can see how that's red. So this would be like if you have a peanut allergy and you blow up, you know, you get like really swollen. That would be like a peanut allergy. That's an IgE response. What we're looking for and what we're measuring here is an IgG. This tells us for long chronicity inflammation or irritation. This is part of your immune system. Okay, so the test that we do is we check for food sensitivities, and this is a IgG test. So let's move to this testing right here. So you can see right up in here, we have dairy, right? Now the longer this graph here, the more reaction there is in your body. Okay, so what this is measuring is, let's just go back to this cell right here. If you have gluten, gluten gets into your bloodstream, and it's a big particle right here. Okay, actually, let me just say this. Let me just do this. So gluten gets in there, and then this would be a big gluten molecule right here. Now your immune system, which is this IgG right here, recognizes this gluten. Okay, so then your immune system is going to produce a whole bunch of IgG. So this is, when this happens here, when your body produces a lot of these things right here, this causes increased inflammation. Now what's happening on the test here, this is measuring the IgG. So what does this tell you? This tells you if you have high levels, which is really high, that means your body's producing a lot of IgGs that go and look for gluten. So the only way this can actually happen, the only way your body can recognize gluten as foreign, as if it was up here and then it came and then it broke through this barrier here, and your immune system saw that and it started producing an IgG, what we call antibody. So what this test is really measuring when we talk about food sensitivities is how much IgG your body's producing. And the more you have of them, the more inflammation you have in your body. So this test is really critical because this person here is sensitive to basically all kind of dairy products. Egg, right? This is the egg yolk, and the you can see here. This is maybe better if you see right here. It's the egg white, egg whole, and then the egg yolk. So if you see this on a test, this is going to be causing inflammation in your body, and inflammation is really the root cause of the problem. When you have inflammation, it's going to cause this leaky gut. So look at this person here. She's allergic to bananas. She's allergic to pineapples. How would you ever even know that unless you test? So one of the things with functional medicine is you want to test, not guess. This test checks 96 different foods. So let's go to the next page. So here's, she's sensitive to almonds. Like, check this out, broccoli, right? Down here you have wheat. So this test is really, really critical to see how many foods you're actually sensitive to. And when you're sensitive to these foods, this causes chronic increased inflammation, and inflammation will cause your gut to start leaking and cause your cells to be crusty, and you're only as healthy as your individual cells. So I hope this helped you out, and I look forward to seeing you. Bye-bye.